You know, it's pretty clear from our first moments when we started covering this issue that there is a continental divide. There's actually a fissure that's cracked open in public health.
There's a rift, a big rift. Yeah.
How did that happen? Because you've got colleagues that you've probably been working with for 20, 30 years that in the last 4 or 5 years, you guys find yourself on opposite ends of this issue.
Yeah, that's very true, and it's really unfortunate. And I think what we have is the classic, you mentioned the Public Health England approach, and that's not just, that's their approach, but it's England's approach as a whole to vaping, which is, it's not as toxic as smoking. I wouldn't say they don't care how much less toxic it is. All they know is that it's much less toxic. Is it 95% safer? I'm not sure the research quite bears that out. I don't want, there's no point in debating that. It's not as toxic. Vaping's not as toxic as smoking. So if a public health agency of a country says, you know, on balance, we'd rather have our people vaping than smoking, there's a reasonable argument to be made in favor of that. The question then becomes, are they still, while they're endorsing that approach, and they have, and there are many people who've quit in England, there's no doubt about it, are they looking as hard as they should, and in my view anyway, and other people's view, I think, but my view is certainly we need to keep studying this phenomenon very closely for an extended period of time, long after you and I probably stopped working, Brent, to see if there are long-term, unanticipated, unidentified at present consequences of long-term vaping, because there will be people, I know several people personally who they vaped they tried other things, they tried nicotine replacement therapy, they tried the prescription drugs, none of them worked. They tried various other smoking cessation techniques, they didn't work. They went to vaping, it worked. And so they vaped for a few months, one or two have vaped for over a year, but they're looking at winding their vaping down because they don't want to continue to be addicted to nicotine. And they don't want to risk that addiction leading them back to smoking. So they're trying to get rid of vapes now that the vapes have done the job that these folks wanted them to do. So that I don't think there's an argument with. The argument is within the public health community, because the tobacco industry has jumped on this alternative way of delivering nicotine as a way of keeping its business going and maybe leading some younger vapers back to smoking. I think that's what I think's going on here.